to the head can result from sudden impact forces to the head or by inertial forces within the skull. Although traumatic brain injury and head injury are terms often used interchangeably, head injury may or may not include injury to the brain. Acute head trauma occurs in varying degrees of severity and complexity, ranging from minor scalp lacerations to severe traumatic brain injuries resulting in prolonged hospitalizations, permanent disability, or death. Keep in mind that even if mild, repeated injuries over time can lead to cumulative neuro and cognitive delays. An example is repeated concussions with sports injuries, such in football. Well, what is the leading cause of head injuries? Motor vehicle accidents, falls, abuse, assaults. It is common also in home and occupational injuries. Among children, bicycle accidents. Head injuries are fatal in 30% of the cases prior to hospitalization and 20% afterwards from secondary brain injury, especially in males aged 15 to 24 and in those over 75 years of age. Mechanisms of injury refers to the way or the circumstance in which an injury occurs. Some injuries can be predicted with certain mechanisms of injuries. For example, the integrity of the skull may be lost in penetrating injuries, but may be preserved in blunt closed trauma. Also, in penetrating injury, there is a higher risk of infection. The damage caused in a head injury also depends on the velocity of impact or penetrating object. Traumatic brain injury is classified as primary or secondary. Primary injury is the result of the initial insult to the brain. It can be focal or located in small specific areas. This can include lacerations, contusions, hemorrhage, or hematomas. It can also be diffuse or occurring over a wider area. Examples are concussions, or diffuse axonal injury. Also, primary injury can include damage at the site of impact or at the opposite side from a contracoup effect. That's when an impact to the head can cause the brain to move within the skull, causing the brain to impact the interior of the skull opposite the head impact. Now, secondary brain injury is the body's response to the primary injury or insult. For example, injury to the brain causes swelling. When bleeding or swelling occurs, there is not a lot of room in the skull, and pressure starts to build quickly within the skull. Intracranial pressure. The increased pressure causes more damage to the brain, which causes more swelling and so on. Well, cerebral edema and increased intracranial pressure can result in cerebral ischemia and infarction from hypoxia. According to the Centers of Disease Control and Prevention, traumatic brain injuries contribute to a substantial number of deaths and cases of permanent disability annually. Scalp lacerations are generally classified as mild injury, but lacerations can distract providers from possible underlying injuries. The scalp is a very vascular area. Vessels constrict poorly, so they can bleed profusely. However, the bleeding is not severe enough to cause risk for hypovolemic shock, except in children because the total blood volume is decreased, or if an artery is hit. If shock is present, you gotta think of other possible injuries. So with shock, an elevated heart rate and a low blood pressure will be evident. Keep in mind that a person can bleed 6 liters into the thorax and pelvis, but not in the brain. If increased bleeding in the head occurs, the person is going to pass out. Well, I mentioned possible underlying injuries depending on the mechanism of injury that may occur. So we have to ask, what happened to the brain and neck? And always think of the neck when there is a head injury. The extent of the injury should be determined with diagnostics and good clinical evaluation. Let's talk about taking care of the laceration. Lacerations are a potential portal of entry for infection and leading to intracranial infection. Therefore, the area is irrigated before the laceration is sutured to remove any foreign body objects, and decrease risk of infection. What else do you do? Remember the tetanus toxoid in the way of Tdap. I want you to look at this diagram that shows the layers of the scalp and head. Although we have lots of dense fibrous tissue in the scalp, there is a potential area for blood to collect and form cephalohematomas, or what we call the goose eggs, and that is under the loose areolar tissue here. Also, large avulsions of the scalp may be potentially life-threatening and a true emergency. Skull fractures are a break to the rigid box around the brain. Remember, the skull is asymmetrical. Remember which bone is the thinnest? The temporal. And the thickest? The occipital. A fracture of the temporal bone may result in a tear of the middle meningeal artery, resulting in more serious brain injury, such as an epidural hematoma. Skull fractures indicate that there was significant force. So if there is enough force to break the skull, then what happened to the brain and neck? So what type of fractures are there? A simple fracture is the most common. There is no displacement, typically is linear, and usually occurs from lower velocity impacts. Comminuted fractures, shown in this middle picture, have multiple fracture lines. Depressed skull fractures, shown in your third picture, have bone fragments that can be embedded into the brain tissue. This carries a high risk of increasing pressure on the brain, crushing delicate tissue. It also may expose brain tissue. It also may require surgery to lift the bones off the brain if they are causing lots of pressure on it. We're going to talk about basilar skull fractures on the next slide, but I want you to remember that the base of the skull is uneven, playing a role in brain injury. Basilar skull fractures are fractures in the floor or base of the skull. They require more force, and diagnosis is made clinically. However, CT or MRI can help confirm. Basilar skull fractures have characteristic signs. One is blood in the soft tissues or sinus. Second, cerebrospinal fluid leaks from the nose or the ears can be noted. There may be a tear in the dura leading to the cerebrospinal leak. This can be noted as a halo ring on linen, and it increases the risk of meningitis, so the MD needs to be notified. Also, test the fluid. It will have glucose. The picture here shows you the concentric rings if there is a cerebrospinal leak. Raccoon eyes are bruising of the orbits of the eyes that results from blood collecting there as it leaks from the fracture site. And battle sign is a retroauricular or mastoid ecchymosis. It typically appears 1 to 3 days after the fracture is sustained. Also, not noted in your slide, is the possibility for cranial nerves 7 and 8 to become damaged as a result of the injury. Remember, that's going to affect hearing and may lead to facial swelling. This picture shows your raccoon eyes, Battle's sign, and here in the tympanic membrane, older dark brown, that's bloody fluid in the middle ear. Skull fractures in itself do not cause neurological symptoms, but frequently they are seen in conjunction with other more serious injury. Clinical manifestations are going to depend on the brain injury that may be present, for example, hematomas or contusions, and the severity and distribution of the underlying injury. Localized pain and swelling usually suggest a fracture is present. Diagnostic studies include skull X-rays, but if a fracture is suspected, CT scan, MRI, or cerebral angiography may be ordered. Non-depressed skull fractures generally do not require surgical treatment. However, close observation of the patient is essential. Depressed skull fractures usually require surgery, particularly if there's contamination or deformed fractures present. Comminuted or open fractures are considered infected, and debridement and surgical closure is often done, as well as use of antibiotics.